Good evening. My name is Daniel.Olivares, and I am a prospective employee and have been given the opportunity to present uh, something for the organization that will essentially make that organization, or your organization rather, more effectively efficient if executed properly. Uh, I believe that there are systems that can be implemented if done correctly, that will make the organization more integrated, more effective, as I said before, more efficient. Collaboration will be easier. Integration between similar systems or even dissimilar systems uh, all can be affected greatly by a core system that creates a lot of the decentralized information that we have within your organization more accessible and meaningful. And by that I mean creating knowledge. There are several companies out there that are currently supporting healthcare uh, systems, and the systems that I'm talking about are the enterprise management systems, and they are the resource systems that are a central core piece of software that is distributed throughout the organization, catered to the organization by which they, given the parameters of the organization that are defined by the organization. I looked at several companies, and I believe that the SAP company has the most thorough and effective system to be implemented. The categories that they cover are patient care, um, care collaboration, healthcare analytics, and then you have your standard um, systems that can be employed, which are the human resources, finance, sourcing and procurement, which obviously is a very big piece of the financial piece, just given the amount of stuff, the amount of medical equipment, amount of uh, medicine, etc., that must be accessible and available in a timely manner for a hospital to run. So they have the sourcing and procurement. And then the last one is platform and technology. And with the platform and technology, this allows them to be more integrated and modular. So there are many areas that the enterprise management resource system has to make it better. But I'm going to focus on the ones I believe, since I've worked in the healthcare system before, make them more accessible and more meaningful to you as an organization. The healthcare piece that encompasses the way we would do care delivery and patient administration and billing is really a very big piece of this whole process. With care delivery, it allows us to manage and connect processes across all the departments that are within the organization. There's collaborative care that we can, using their platform, integrate and make data information more accessible between departments to coordinate better care. And also we have clinical analytics. I think it's something that gets lost many times in organizations, especially hospital organizations that are large and complex. Looking at the most basic functions that we do at the clinical level and addressing them in each clinic will ultimately and should effectively make the organization more effectively efficient, as the stakeholders in the organization adopt and embrace the new systems, they surely will be able to see the benefits of learning the new software, learning how to integrate it into their daily routine so that the care that is given and how the system works within their clinic and within the hospital can most benefit all of the stakeholders, including the patients, since that's the primary reason that we're there for. The other one for healthcare would be the patient admin and billing. Key here is there is a need to shorten the time from the patient arriving and registering to the time that billing has been established. And the system that they have there makes that process shorter because of all the resources and data that the system pulls from to allow it to capture all of the necessary information, whether it be third-party billing, because the patient may have other healthcare, and just in general make the process of getting billing taken care of quicker. Also, there is the coding. Coding is obviously very important to you as an organization because of the need to correctly code and therefore bill insurances. And so with their software, the SAP software, it makes it again more accessible, quickly, more integrated, so that you as an organization can continue to profit and reinvest, obviously, the monies that are collected at more quickly, so that procurement and things of that nature are not kept in a stranglehold because the resources are tied up in trying to get that money. Care and collaboration. There is another one to really focus on because it allows for, the organization to engage the patient outside of the arena of the hospital. So in that way, the organization can put not necessarily the onus, but the demand to get better, live better, do the things that are going to keep the patient more engaged and more responsible for their care. So there is that need to integrate what's happening at home and monitoring it either through devices or check-ins or whatever it may be, so that the patient is empowered to essentially be responsible for their care, and the onus would be on them. And we would also be able to monitor that process through the system that SAP provides. Obviously, it's only as good as the people that use it and how the patient integrates it into their life. But it still provides another tool for us to become better care managers for the patients. Also, patient relationship management is another piece to this care collaboration. I think that this is also very important because many times when you have care for patients, the management of referrals and where they go or whether they get lost in the system still to this day is a difficult process to maintain. And I believe that with this system, there is an ability to have providers, the doctors or whomever, manage and follow the care of the individual. Because of the need to ensure that A, they go to their appointments, B, we continue to bill, because that's, if they're not coming, then what that means, A, they're getting either more sick or they're just not following up. But more importantly, if they're outside referrals, we want to keep track of that so that we can manage their patient care through that way. The SAP system provides a dashboard that allows providers to track these types of things, such as consults, in order to manage their patients, provided the time necessary to do that if they do have that time. The last thing that I'm going to talk about is the healthcare and analytic research. Uh, with the healthcare and analytic research, the key here, and I think this is the big piece to all of that, is integration of systems, data, that ultimately becomes knowledge. The research piece, yes, uh, as a learning hospital, there is the need to take a lot of the information, the data that we may have, and integrate it into our research so that we understand what we're doing, but more importantly, we understand that there are other people within the organization that maybe have the same problems or maybe are focusing on the same things, and collaboration is a piece of that. With the healthcare analytics and research module that comes with the SAP platform, you are able to get real-time data on patients, real-time data to make decisions, and also to focus on things that may be important to look at and collaborate on across the areas. Because it's necessary, we are an organization. We're not individualistic in our care. We're not stovepipe, as the term is sometimes used. We are integrated within one another's processes. So with the research piece, the healthcare the analytics piece gives you the metadata, the data that is necessary to really really analyze the data that is inputted into the system that may be already there, and use it to create knowledge that will ultimately affect and help the patient overall. So with the analytics piece, I think this is where, excuse me, you get the opportunity to really focus on the information, the data, integrate it, analyze it, develop some type of a system that I believe the SAP programs, resource management system program provides, will allow you to ultimately be better at your jobs and become more effective and more efficient in the processes that you handle every day, and look for insights that come across the whole spectrum of the hospital. And that's where the analytics piece and all the data mining and structuring of data and making it knowledge comes into play. And I believe the software, SAP, all this information comes from sap.com, their main website under the healthcare piece. Again, the other ones, financing, sourcing and procurement, and platform technology, human resources, all are very critical to the overall function of the hospital. But the four that I highlighted, I think, or the three rather that I highlighted, are more directed towards the management of our patients, the way we integrate with each other across platforms, to make, in the end, a better process for the patient. Happy patients, better systems to keep them happy, less wait times, more informative decisions by doctors, and the ability to track patients, all can be encompassed within the SAP system. So again, those are the three. I would invite you to look at the human resources, finance, sourcing, procurement, and the platform technology if it's relevant to you. But again, the end state is happy customers, well-informed customers, effective care from our providers, and integration across all platforms so that we as an organization can be more effectively efficient. Again, thank you. Thank you for the opportunity to speak with you today, and hopefully we will have the opportunity to do this again. Good night.